spread by direct contact. Smallpox transmission. Clothing, bed linen. Smallpox transmission. Must strive to maximize patient safety. Nurse's role during a disaster. Incubation 1 to 6 days. Anthoxy. Inhalazione. Anthoxy transmission. Air ducts and vent are sealed. Nuclear radiation decontaminazione. Mental status unable to follow simple commands. Immediate emergency red calorie. Diarrhea. Diarrhea. Anthoxy symptoms. Incubation 12 days. Smallpox. Fever. Anthoxy symptoms. Age history, past medical history. Secondary survey. Abdominal pain. Why? Anthoxy symptoms. Activities that reduce the effects of disasters. Mitigation. May be able to assist in own care any ambulatory patient walking wounded. Why? Minor, non-urgent. Why green color. Diarrhea. Anthoxy symptoms. Fever. Anthoxy symptoms. Activities that reduce the effects of disasters. Mitigation. After 1 to 2 days, a maculopapular rash appears on the face, mouth, pharynx, and forearms.
Maculopapular.
Or describe a rash with both flat and raised parts.
smallpox symptoms. Cover floor and use strict isolation precautions to prevent the tracking of contaminancy. Nuclear radiation decontaminazione. Warning System C. Preparedness examples. H. History. Secondary survey. Any patient who will die before appropriate treatment is available. Expectant deceased CDY black trige tag color. Activities prior to a disaster. Preparedness. Step protection Y. Nuclear radiation decontaminazione. Any patient who does not have respiratory effort after attempting to open the airway. Expectant deceased CDY black trige tag color. Search and rescue. Response examples. Breathing. Primary survey Y. Activities during a disaster. Response. Building codes and zoning. Mitigation examples. Includes compromises to patient's airway, breathing, circulation.
Airway compromise.
Immediate emergency Y red #, calorie. Varroa virus Y. Smallpox cause. A severely injured patient who needs evaluation and treatment but may not require immediate transport. Delayed urgent YY yellow #, calorie. I inspect posteriori.
Further.
I inspect posteriori. Secondary survey. Claims processing and grants. Recovery examples. Must be aware of their employer's response plans. Nurse's role during a disaster. YF full set of VSI. Secondary survey. Perfusion, no radial pulse or a capillary refill time greater than 2 seconds. Immediate emergency Y red #, calorie. Status unlikely to deteriorate over days. Minor, non-urgent YY green #, color. I inspect posteriori. Secondary survey. Disability neurologically. Primary survey Y. Dosimetry devices. Nuclear radiation decontamination. Backache. Smallpox symptoms include serious and potentially life-threatening injuries, but status not expected to deteriorate significantly over several or c. Delayed urgent YY yellow triage tag coloring. H history less mealy. Secondary survey. CAPS. Nuclear radiation decontamination. Emergency exercises training. Preparedness examples. Backache. Smallpox symptoms. Preparedness plans. Preparedness examples. GI, undercooked meat or dairy from infected animals. Y. Yanthixi transmission. Disaster drills should be conducted at least twice annually when involving community-wide resources and actual or simulated clients. Nurses' role during a disaster. Raised bumps. Smallpox symptoms. Requires medical attention within minutes for survival / up to 60. Y. Immediate emergency red triage tag coloring. Respirations greater than 30 per minute. Immediate emergency red triage tag coloring. 2 pairs of gloves. Nuclear radiation decontamination. Bacillus Y. anthracis. Anthrax cause. Public education. Y. Mitigation examples. By contact with clothing or linens. Smallpox transmission understands that the role varies during disaster. Nurses' role during a disaster. Face-to-face exposure. Y. Smallpox transmission. Victim can be helped by immediate intervention and transporting. Immediate emergency red triage tag coloring. Emergency operations. Response examples. By contact with clothing or linens. Smallpox transmission. Open source. Smallpox symptoms. Respiratory fever. Y. Yanthixi symptoms. Most severely injured or ill victims who require the greatest resources are treated last to allow the greatest number of victims to receive medical attention. Y. Reverse triage. Public warning systems. Response examples. Headache. Smallpox symptom. Skin direct contact. Yanthixi transmission. Activities following a disaster. Recovery. Headache. Smallpox symptom. Headache. Smallpox symptoms. Fever. Smallpox symptoms. Water-resistant gowns. Nuclear radiation decontamination. GI ingestion. Yanthixi transmission. Managed Care is a healthcare delivery system that focuses on decreasing costs and improving outcomes. Managed Care, what is it? What are the benefits of using it? Circulation, why? Primary survey, why? Use standard precautions. Ethics precautions. Must understand ethics associated with choices they might have to make. Nurse's role during a disaster. Spreads down body. Smallpox symptoms. Why victim with relatively minor injuries, patients requiring minor treatment or prophylactic evaluation. Minor, non-urgent YY green trash tag color. Expose environmental Y control evidence. Primary survey, Y. Temporary housing. Recovery example, age history, allergies. Secondary survey, extremely contagious. Smallpox transmission, temporary housing. Recovery examples, extremely contagious. Smallpox transmission. Skin contact, Y. Yanthixy transmission, by droplets person to person. Smallpox transmission. Treatment is supportive care with antibiotics for any additional infection, pain medication, itchy medication, Y. Smallpox. Respiratory, sore throat. Yanthixy symptoms. Respiratory, muscle aches. Yanthixy symptoms. Airway with cervical Y, spine stabilization, Y. Primary survey, Y. Exhaustion. Smallpox symptom. Skin contact, Y. Yanthixy transmission. Treatment is supportive care with antibiotics for any additional infection, pain medication, itchy medication, Y. Smallpox. Exhaustion. Smallpox symptom. Exhaustion.
can leave you tired and without energy to set goals and stick with them. An overwhelming urge to sleep, and you may not feel refreshed after you rest or sleep.
Smallpox symptoms. Age history, events surrounding injury. Secondary survey. GI, bloody diarrhea. Yanthexy symptoms. PT must be isolated. Transmission precaution / standard contact, droplet and airborne. Y. Smallpox. Virus. Smallpox. Body fluids. Smallpox transmission. High fever. Smallpox symptoms. PT must be isolated. Transmission precaution / standard contact, droplet and airborne. 1. Smallpox. Bumps fill with thick fluid with depression in middle. Smallpox symptoms. Vulnerability analysis, a review that focuses on security-relevant issues that either moderately or severely impact the security of system. Mitigation examples. Respiratory inhalation. Yanthexy transmission. Skin lesions. Yanthexy symptoms. Respiratory SOB. Yanthexy symptoms. GI nausea. Yanthexy symptoms. Respiratory symptoms that mimics influenza. Yanthexy symptoms. Skin lesions. Yanthexy symptom. Skin lesions. Yanthexy symptoms. Skin small sore. Yanthexy symptoms. Pustular rashy.
A patch of large red bumps that have pus inside.
Smallpox symptoms. Masks. Nuclear radiation decontamination. Buddhisy. Nuclear radiation decontamination. Rash / spot on tongue mouth. Smallpox symptoms. Respiratory chest pain. Yanthexy symptoms. goggles. Nuclear radiation decontamination. Any patient who cannot walk but has respiratory drive and are within normal limits with RPM equals respirations, pulse and mentation. Delayed urgent YY yellow trich tag coloring. Be aware of state regulation. Nurse's role during a disaster. Why victim unlikely to survive given severity of injury. C. Expectant deceased CDY black trich tag color. Palliative care and pain relief should be provided. Expectant deceased CDY black trich tag color. Aerosol. Smallpox transmit. G give comforting. Secondary survey. Aerosol. Smallpox transmission. Skin ulcer with black spotty. Yanthraxy symptoms. Antibiotics within 24 hours YX 60 days. Anthraxy treatment. Skin blister. Yanthraxy symptoms. NNV. Yanthraxy symptoms. H history medication. C. Secondary survey. Does not spread from person to person. Yanthraxy transmission. Tried outside the hospital. Nuclear radiation decontamination. Skin blister. Yanthraxy symptoms. Respiratory cough. Yanthraxy symptoms. Long-term medical care and counseling. malaise.
A general feeling of discomfort, illness, or lack of well-being.
Smallpox symptoms. Long-term medical care and counseling. Recovery examples.